Good afternoon. This is the Board of County Commissioners Board Work Session. It is Wednesday, May 24th, 2023. It is 3:30 p.m. This session is set to go until 4 p.m. This is a hybrid meeting. We're at 3000 Pacific Avenue Southeast, room 110. For public virtual attendance, you may follow along on the Thurston County YouTube channel. I'm Carolina Mejia. I'm the chair of the board. To my right is Vice Chair Ty Menser. To my left is Commissioner Gary Edwards. Also in the boardroom, we have County Manager Ramiro Chavez, as well as Assistant County Manager Rob Gelder. And we have our new, I'm not sure which title to address you as. We have our Regional Services
Carrie
Director.
Hennon, representing Public Health Treatment Sales Tax today.
Okay.
Thank you.
And Shaylin Sowers, representing Thurston County Public Health Treatment Sales Tax. I'm the data analyst.
Okay, perfect.
All right, thanks. So as you know, treatment sales tax is local funding for behavioral health, funds treatment courts and treatment services and related support services. Small but mighty, we say, so smaller amount of funding than some of the other public sources of behavioral health funding, but we're able to do a lot of different things with that. The county code says something like, staff will provide the county commissioners with an annual update on use of the fund. So here we are to provide you with an update on our 2022 annual report. This is an information only briefing, so we will summarize and happy to take your questions. Let's see, so in 2022, I'll do this one, there was about $8.3 million in revenue from, of treatment sales tax, and we spent $7.9 million. You will note that we had more revenue than expenditure. That has been very consistent with TST over the past many years. We do have a large fund balance. We did, for a number of reasons, see underspending again in 2022. We had budgeted to spend close to $10 million, so there was about 18% reversion to the fund, which is pretty significant and more than you see in a lot of other funds. Once again, in 2023, we are aggressively budgeting and with the goal of spending down the fund balance, but we did grow the fund balance a bit in 2022. We're going to tag team this a little bit, and Shaylin will tell you a bit about who we served with TST funded programs.
So in 2022, TST program served 4,348 clients. However, we do like to make a note here that the number likely includes some duplication as TST clients can enroll in multiple programs. And the demographics are towards the bottom here, and you can see that they're similar to that of the Thurston County population. So most of the clients identified the race as white, ethnicity as non-Hispanic or non-Latino, and gender as male. And the highest proportion of clients served were between the ages of 25 and 54, followed by 15 to 17 years old. And most clients, and you can see here under the housing status and zip codes, the highest proportion of clients lived in 98503 and 98501, so Lacey and Olympia, and 13% of clients identified as homeless or transient. So moving on to the next page. I'll let Carrie give an overview.
As you can see, TST funds many, many different programs. We've sort of organized those into a couple different categories here. So treatment sales tax does fund our therapeutic courts. Those are specifically named in the statute that allows the county to collect this fund source. So we spent about close to $1.5 million on the adult therapeutic courts. We spent about $2.6 million on a wide range of programs that serve youth and families. Other adult programs outside the treatment courts, we spent about $2.7 million on. $630,000 in 2022 was spent on community grants, and then about $500,000 on administration, which does also include training and some indirect costs. So again, long list, then the remainder of the report is kind of organized according to those basic categories. So treatment courts, youth and family programs, adult programs. Back to you.
And a few other notes I wanted to share on this because this focused a lot on how TST was spent. We also wanted to share a little bit about how the budget was allocated. So programs that serve adults accounted for 37%, so about $3.5 million of the budget, which is closely followed by those that serve youth and families at 32%, which is about $3 million. 31% of the budget went towards programs administered by the Thurston Mesa Behavioral Health Administrative Services Organization, very long name, the TMBHASO, followed by Thurston County Public Health and Social Services at 26%. And then we also wanted to note here too that 43% of the budget goes towards programs providing adult criminal justice services, and then 20% provide community behavioral health services. So as Carrie already mentioned, the next few.
Quick question before we move on. So the the dollar amounts that you listed on this page, are those the program funds or the spent funds, considering the large reversion?
These are expenditures.
Okay, the actual expenditures, okay.
Yes, yeah.
Okay, I guess I wanted to follow up on clarity on that then. So where you say you brought in 8.27 and you
Yep,
spent
8.2, 8.3, yep.
7.89,
Mhm.
is that actually what was spent or was that allocated?
So that 7.9 is spent, the budgeted amount was roughly 9.5.
Because
So
we had an
we
ending fund
underspent by
balance.
almost $2 million.
Yeah, so what was the ending fund balance side in
So I'd have to
2022?
look that up, I could get that back to you. The ending fund balance, to guesstimate, I'll say probably 7.6 million.
And then
high
then we
sevens.
brought in another 7.8 after that.
Well, no, ending fund balance is after we,
Okay,
for 2022, that's after
you
we brought
allocated,
in the 8.3 and spent the 7.9. So we
Okay.
grew the fund balance by 400,000-ish. I think it was 7.2 going into 2022. I can get you
oh, that's fine.
the specifics, but it's
Curious.
significant.
Oh, yeah, thank you.
All right. So the next few pages.
Yes,
that we'll-
I always am.
The next few pages that we're gonna be going through, they dive a bit deeper into annual client serve totals since 2020, as well as a few notable data points for each of the sections. And I just wanted to point out a major factor that has impacted client serve numbers since 2020 has been the COVID-19 pandemic, where we saw many programs reduce their caseloads, their capacity to prevent spread, as well as experience some significant staffing challenges. So just wanted to give that little note there. So for drug and DUI court, mental health and veterans court, 91% of the funding for these programs comes from TST. Highlight for these courts, specifically for mental health and veterans court, is that they were above capacity at the end of the year, seeing caseload numbers similar to that actually before the pandemic. And then drug and DUI court, their participants have returned to full in-person services, and in 2023, they'll continue to build up their census. And as you can see, drug court is on the very far left here. Their census has been kind of trending downward, so they're gonna continue to work on building that up. Great. Moving on to the next page. As you can see, there are many youth and family programs funded by TST. 87% of the funding for these programs comes from TST. And as a side note, which is a bit more noticeable on these ones, if a bar is missing from the client serve chart, it just means that that program didn't exist for that year. So for example, there's a children's mobile crisis, juvenile justice, they didn't exist in 2020, so there's only 2021, 2022. Let's see, so some highlights from 2022 included the launch of the Transition Age Youth Wraparound with Intensive Services, which is called the TAYWISE program. And they serve youth ages 15 to 20 at high risk of criminal justice involvement due to complex behavioral problems or mental illness. And then the Juvenile Justice Behavioral Program, which is also called JJBHA, they completed over 200 hours of community service at various locations around the county, including the Courts Garden Project and Thurston County Food Bank.
I have a question on that. So could your community service be litter pickup?
Could, help me understand your question. Could whose
Well,
community?
we have a
service?
litter patrol. A
Sure.
lot of times we use inmates out of the jail and we're having a harder time getting inmates out of the jail. I wanna keep the county roadways all cleaned up as best I can. So could we use, those folks that are assigned to community betterment programs of one type or another? Why couldn't we work out something, have them work with our litter control people? They're supervised and go out.
I mean, so what you're looking at here are almost entirely voluntary programs. The youth programs in particular, most of these are not
I just wondered,
court
I'm just
involved
asking the
programs,
question.
could they as a, you know, for pro-social activities or for kind of building engagement in the community, add that type of thing programmatically? Sure.
Just wondered.
But most of these on this page are not, you know, not where they're going to be assigned to
Okay.
community service. This page, I will say, probably highlights, or maybe the whole report, why you have an advisory committee so that you don't have to keep these 35 programs and all their different acronyms straight. Job security for our volunteer advisory committee.
Alright. The next two pages are gonna cover adult programs, and we have these separated by two different types. So this first page is gonna be for those that are based out of the Thurston County Correctional Facility. So 68% of the funding for these programs comes from TST. And as mentioned earlier, the COVID-19 pandemic has had a significant impact on clients served, and many of the programs in the jail, they found ways to still provide services at limited capacity, including offering virtual modalities. And they also recruited more staff as shortages did make it more difficult to operate at full capacity throughout the whole year. In addition, the transitions in medication management and Thurston County Corrections re-entry assistance programs were transitioned to the Thurston Mason Behavioral Health Organization after June 2022, and they're now provided through a program called the Jail Behavioral Health Program, JBHP. Now, this is the other type of adult programs. We just call it other. There's ones that are not run out of the Thurston County Correctional Facility. So this includes programs like the Nisqually Jail Case Management, Pretrial Services Diversion, Public Defense Social Services, and a few others. 53% of the funding for these programs comes from TST. And a highlight is the launch of the Pretrial Services Resource Hub at the Courthouse Complex. That's they've been providing referrals to behavioral health assessments, treatment, education or employment, housing, public benefits, many services. They're still continuing to find a way to calculate or collect unduplicated client serve numbers at this point in time. However, they've been able to report that they've had a total of 183 on-site visits and 49 remote visits in 2022. And the last,
Can I ask questions on that?
Yeah.
So, okay, so the second program there says intensive case management. What does that mean? Who's being case managed?
So there are actually quite a few programs in the community that use that name. So what we're talking about here is, so treatment sales tax, we provide funding via the TMBH ASO. They subcontract with Northwest Resources. This is one of our longest standing TST funded programs, and what they are really doing is substance use disorder assessments and connection to treatment, really connection to inpatient bed dates. They're doing that kind of on a mobile basis. They do go into the jail and also community-based, so encampments out in the community, meeting people at McDonald's, et cetera. So kind of taking SUD assessments out of a formal outpatient office setting and doing those assessments out in the community and then linking to bed dates. This program has been super productive. They are very busy doing lots of assessments and connecting a lot of people to inpatient usually.
And is there like, how much money do we spend on that piece? Is there a cap? They just bill for what they do, or have we allocated X number of dollars?
That we fund on a FTE basis, and it's, I could bring you all that data, roughly $180,000 to $190,000 a year. We're funding 2 FTEs who are substance use disorder professionals.
Okay, I mean, if you take, like, if we take off our commissioner hats and law and justice hats and TMBH ASO hats and all that, and just what we hear in the community is that, you know, drugs are a problem. Most people seem to be sensitive that it's a health issue and not really, the criminal justice isn't the best way to deal with it, but they want to see people get into treatment. And then you hear, but there aren't bed dates for people, they can't get them into bed dates, you know, so of all the things in this really seems the most directly focused on that need. What you just described is plugging that hole of trying to get, I mean, it's not running an in-care, it's not running an inpatient facility,
Sure.
which private companies do for millions and millions of dollars, but it seems like it's the best thing. So to me, $188,000 spent on that seems very, very low.
It is a very productive program, I would say. I think you get a lot of bang for your buck for that investment. There's a lot of great programs who could all make a strong argument that they are in different ways responding to the, a really significant community need that you identified. A lot of programs are doing a lot of mobile work and connection work, but that program is connecting a whole lot of people to treatment for sure.
And if we're trying, I'm just thinking, if we're trying to find ways to deploy an excess amount of resources from underspending, and we want to, I mean, I'm just thinking of what I hear and what I think the community believes are the needs for substance abuse treatment capacity. Be nice to have, I mean, I know these facilities are expensive and stuff, but in a perfect world, somebody has a need, whether it's law enforcement, diversion, or a social worker or whoever, like they just get them in there. Like there's available inpatient bed for people that need it and are willing to go into it.
Right, and then, ideally, in most cases, someone else, usually Medicaid, is paying the tab for that part. So this is the, that
Getting it.
connection piece and having the capacity to do that. They can draw down a very small amount of Medicaid when they're doing assessments in the community. It's not enough to fund full FTEs who can be out doing that work every day or do it in the jail where they can't draw down Medicaid. So that to have that capacity of 2 dedicated FTEs to be out and about in the community doing these assessments is really great. And again, this is one of our longest, way predating me, ICM has been doing this work. Other questions?
How many of these on your program performance list, for an example, have to do with lead?
Meaning how many, I mean, certainly there would be
Well, like Thurston County
connections,
Sheriff's Office
referrals.
co-responder.
Sorry?
Well, Thurston County Sheriff's Office co-responder says it's new for 2022. 263 referrals, but referrals
So
to
that's the
lead,
scout program that the
That's a what?
ASO, the scout program, they call it for short. So
Okay.
the ASO/OHRS has partnered with Lacey, Olympia, and the Sheriff's Office for kind of different variations on this theme of mobile outreach. Only the Sheriff's Office program receives TST funding, Lacey funds their own, Olympia has their own model. So, but this is, and we're not even picking up the whole tab for this, I think they are drawing down some Medicaid for that. But this, and I listened to some of your lead briefing this morning, this would be an example of a program where, they might deploy instead of sheriff's deputies, do that kind of crisis work, and then they might make that referral to lead for the ongoing work. And that because all those teams do operate under the same umbrella at OHRS, without speaking for them, I think they have tried to build those connections from their law enforcement connected staff to the LEAD program.
Do you remember the amount of TST dollars that have been allocated to the LEAD program overall?
Allocated or spent? 0 spent.
Allocated.
No TST funding has been spent yet.
Allocated.
That I could get that to you.
No, just
Quite a
it-
bit. I think last year. So we had allocated some in 2021 and hadn't spent it. I couldn't tell you how much that was. In 2022, 300 maybe. In 2023, we had originally allocated 550. We've now pulled that back and said it'll be less than that. We've redeployed some of that to more community grants.
Where's that vacant, or that unspent fund?
And the
That's
fund-
part of that 17.
It's in your fund balance,
And the
yeah,
fund balance.
yes, fund balance, and some of it for this year, we were able to redeploy to some additional community
And
grants.
the reason they have not been gone unspent in the LEAD program is because we were concerned that perhaps the grant was not going to be covering all the costs. But it seems like the state continues to fully fund the activities on the LEAD. So that I think is a little bit different as to why the LEAD program has not spent TST allocation.
Absolutely, and I think, rewinding 2 years ago, I think we received kind of a directive from the commissioner's office saying TSC needs to be available if the state doesn't fund this anymore. The problem is the state's not gonna tell us 2.5 years out necessarily what they're gonna
Right.
fund, so that it's a challenge of different fiscal years, different, trying to build a biennial budget locally when you don't know what the state's gonna do. I imagine we'll have the same question going into the next biennium.
Well, it's a good
Although.
stopgap strategy for lead.
Right. Yes.
How about the veterans case manager? 100% of clients went into treatment. at
We
Exeter.
probably should have a number on that one. Okay, so that funds a very small slice of a person at Public Health who is also funded by the Veterans Assistance Fund. And they have, the total number of clients served is probably like 4 or 5 for that, so we probably should have a note
Pretty
about,
light.
that's a pretty
Okay.
small, they're serving, if someone is booked into the jail who is a veteran, they hopefully are doing intakes on all those people and connecting to services they're eligible for. With the pandemic, they have been unable to serve as many people as they were before for all the
Okay.
pandemic related reasons. Can we do the last? Thank you. So kind of overall in 2022, in addition to spending money and serving people, through your decision-making, there was a pretty significant increase in the amount of funding allocated to community grants. That was done, I think, because of some of the underspending in other areas. So as recently as 3 or 4 years ago, we only had about $300,000 to $350,000 under contract for our community grants. We now have about $1 million under contract for community grants. So, and that has, I think, created some great new partnerships and programming. We did a lot of training and education in 2022. We did a partnership with NAMI and Justice Not Jails. We did a lunch and learn program and got continuing legal education credits for attorneys to try to highlight, bring a lot of the new attorneys in those offices up to speed on some of these, the therapeutic courts, diversionary options, et cetera. We sponsored motivational interviewing training for a lot of TST funded people. We had a new data analyst, a couple new advisory committee members. We did some work around jail reentry. I think Shaylin sort of mentioned a change in provider in the jail in terms of who's managing some of that reentry work to consolidate some of that under the Olympic Health and Recovery Service team. That's gone really well, and as part of that, they've tried to bring those various partners together. We worked with our programs on DEI goals and with our advisory committee on some DEI discussions.
Can I ask about that?
Yes, which part
So,
or both?
on the DEI goals, specifically, looking at the statistics on who you've served, I'm wondering how you're expecting those DEI goals to expect on who you've served, because over here it's, just the data speaks for itself.
So what we did in 2022, and I think we're thinking about a different process. We had a great discussion with the advisory committee last week. The advisory committee has asked programs for a long time, like, what are you doing to advance DEI in sort of an abstract way, and then gotten abstract answers a lot of the time. In 2022, we said every program, every office is kind of in a different place in terms of who they're serving, what type of training they have, how they define DEI goals. So we said, hey, we're gonna meet you where you are. Tell us one specific concrete thing that you are going to do, and kind of let them set their own action steps. And then we did loop back and say, hey, what did you do? Sometimes their action step was, we're gonna look at our data, see who we served, see who we didn't serve. Don't think we feel like we got a lot of traction on that. What we talked about last week with the advisory committee was probably going into the 2024 agreements, the memorandum of understanding contracts, asking as a deliverable, asking everyone to put it in a SMART goal or SMART objective format and say, these are the concrete specific things. And I think it'd be great if we can do some kind of training around, well, what is a SMART objective and what kind of impact do we hope to see? But it's been sort of an ongoing discussion, and I don't know that we feel like, again, different programs are in very different places in terms of what they're thinking about, what kind of impact that discussion has had. And TST is generally funding, you know, a tiny slice of a organization's work. So sometimes they are doing kind of an array of activities based on their other kind of non-TST book of business. So we're trying to align with their overall work. Okay, I'll drop it. Okay,
Your two departed folks in January, and now we're in May. I haven't seen any applications. Do we just not have applicants, or that's being vetted through you and we haven't seen them yet?
you did appoint 2 new people, actually.
Oh, did we replace
Yeah,
them?
this kind of reflects just the 2022 committee. You did appoint, so 2 people just departed. You appointed 2 great new members. They've come to 2 meetings. Ali Abid, who was with the prosecuting attorney's office for a long time, and what's that?
So I guess I remember that.
You do a lot of work. Rachel Drian is the other member. She's great. She's held a lot of positions in behavioral health and at the state level and at King County, and she's a graduate of Thurston County Drug Court 20 years ago. She's great.
Okay.
So goals for the rest of the year. Really, the big work for the advisory committee and thinking about this $7.6 million fund balance is building a budget recommendation. So stay tuned for a budget recommendation in September or October.
Is the TST committee operating correctly?
Yes.
Okay, thank you.
Thank you. Okay, I have to go, but I just want to thank you, Carrie. Thank you, Shaylin, for, Shaylin?
Shaylin, yeah.
Okay, for a great presentation and for the great work you do, really. I'm not sure if commissioners have additional questions.
No,
I
I don't.
can pass
Ready
it.
to adjourn, it's fine,
Okay.
unless you guys have more to present.
Okay, so 3:58, we're adjourned. Thank you.